All right, well, good afternoon, everyone, and welcome to the Florida Chamber of Commerce and the Florida Chamber Foundation's webinar. We've got an exciting day planned for everybody. We have a number of speakers that will include Governor DeSantis's Chief of Staff, Shane Strum. You're also going to hear from our Chief Economist, Dr. Jerry Parrish, as well as David Hart, our Executive Vice President. And what I want to do is I want to set the stage for what we're going to do over the next hour. I think the whole world continues to watch Florida right now. Everyone knows we're about to begin the process of reopening the 17th largest economy in the world, and we need to make sure we do this right. And so expect increased communication from the Florida Chamber over the next couple of days, and you'll hear more about what to expect from Governor DeSantis' Chief of Staff here in just about 15 minutes or so. So what you're looking at now on screen is what the agenda is going to be today. After I share with you some of the survey results that you shared with us, I'll go straight to David Hart. We've been getting a lot of questions regarding the governor's task force and all of the people and all of the questions that have been asked about the eventual reopening of Florida. David's going to give a little framework there. And then, of course, David will introduce Shane Strum from the governor's office, the Chief of Staff that we've been working so closely with throughout this whole process. And then after that, I'm going to go ahead and we're going to talk about restarting our economy, and we're going to hear from our Chief Economist, Dr. Jerry Parrish. And before you know it, the hour will be up. Again, just to give a little context before I share the survey results with you, today's been another day of leadership for us here. This morning, we had a statewide webinar with 185 local chambers of commerce throughout Florida. This is our 5th week in a row where we've been uniting local chambers together to ultimately position local chambers and economic development groups at the local level to be able to build a framework with mayors, with county commissioners, and especially with business leaders to make sure that, once we knew what the White House's guidelines would be, which I shared with you the day that they came out, and then once we had a handle on where Governor DeSantis was going to go with a careful, methodical, science and health-based reopening of our economy, then the next step would be making sure we have common local framework. So again, we had 185 chambers on our call this morning. Shane Strum from the governor's office joined that call as well, and we walked through what to expect the next couple of days in terms of announcements and so forth. And then I just finished a call. I'm the national chair of the National Association of State Chambers, and the U.S. Chamber, as well as all 50 state chambers, are working together on a joint task force to make sure that the White House, in working with governors and working with mayors, has a parallel track where it's the U.S. Chamber, the Florida Chamber working with local chambers. That way we have a fighting chance of having a common theme of how we're going to open this country, really one region, one community at a time. So we just finished a national press call. We had the Wall Street Journal and Reuters and Congressional Quarterly and others. And there's strong interest in, obviously, our governor was in the White House today talking with President Trump about what the reopening of Florida might look like. And I think it was 3 weeks ago on our webinar when I said, I think that Florida actually has an opportunity to set the global model, the global example for this reopen. And I know we took a lot of flack for sort of, how we methodically and carefully got to where we are now. I think the safer at home order is one of the smartest things that any state has done. I think the way Florida did it is really proving to have been beneficial from a health perspective. But in terms of restarting our economy, I think it's one of the smartest things that we could have done. And I think it really positions us for the right kind of reopening. And so that's a bit about what we're going to get through today. Next slide, please. What I want to do now is over the last month, we've had over 6,000 of you participate in various webinars. We've had the governor's team and the governor and so many people. We're going to continue to do this over the next couple of weeks. We're going to continue to publish our morning email starting tomorrow. I think you'll begin to see, every time we learn details of exactly what part of Florida is opening, what industries can open, under what conditions. We're going to continue to be your best source of information for that. We have our entire team focused exclusively on providing members of the Florida Chamber and our foundation inside information that you can use to safely restart your own company along the guidelines that the White House and the governor will be unveiling. Next slide. So what I want to quickly do before I turn it over to David Hart is I want to be a mirror for you and give you feedback of what you told us. And so this is the question of really how long can your business sustain being in a safer at home environment. And nearly a quarter of you said that you could do this indefinitely. And I think that once we restart and recover, keep that number in mind, because we're hearing from many of you that some of you may stay in this environment indefinitely, not just because you can, but because it's actually pretty productive. But again, I don't know where each one of you falls on this spectrum, but I simply wanted to give you a perspective of what the Florida Chamber's membership look like in terms of how long you can continue in this environment. The next question talks to a phased-in reopening. And this is really good news, because I think if you look at what the governor has said we're going to do relative to a very measured approach using hard data from the healthcare field, we're clearly going to have a phased-in reopening. So the fact that the leadership of Florida's business community supports that, is on the same page with where Governor DeSantis is going. Once again, I think it pre-positions Florida to not only be the national model, but clearly an international model of how to get this right. Next question really had to do with, whether you as chamber members have received your federal funding, PPE, EIDL loans, and so forth. Nearly 60% of you that responded didn't even apply for this, but about 15% of you did, and you've already had it. About twice as many of you have not received it. Hopefully the next round will make that available for you. And then finally, we had a question relative to whether you've had to lay off or whether you've had to furlough. And the good news is almost 70% of you have said that you have not had to, and you can see the numbers there. Clearly, this has impacted quite a number of companies in a big way, but it hasn't impacted everyone. And so I think it's important to remember that. So next up, what I wanted to share is, on the next slide, please, is, what is the one thing government can do? And you can all read this, and this will be available later. And so I'm not going to take the time to go through all of these right now. But again, access to capital, what will the phased-in approaches look like? But I just want to make it clear, our number one priority at the Florida Chamber is safety. And how can we safely reopen this economy, one region and one sector at a time? And again, we're going to continue to do our best to make information available for you as we learn it, you'll know it. So next slide, please. I want to introduce now our Executive Vice President, David Hart. David manages our entire legislative and political operation, and for the last 2 months, we've converted what you normally know as a lobbying and a political operation into essentially a help desk for our members, using the relationships we have with agency secretaries, with members of Congress, to try to get our members the best information that's available anywhere. And I've asked David to just give a quick perspective on what we've been seeing over the last week or so, and then David will introduce our good friend Shane Strum, the Governor's Chief of Staff. David?
Mark, thank you. Good afternoon, everyone. Thank you for joining us. Let me just point out on this first slide that at the bottom, my email address is there, dhart@flchamber.com. And if there's anything you hear me say over the next 3 or 4 slides that sparks an idea or a concern or a question, please feel free to email me, and I'll answer those as soon as I can after this call. Next slide, please. Last week, as you know, Governor Ron DeSantis announced and kicked off his Reopen Florida Task Force. It was made up of an executive committee chaired by Lieutenant Governor Jeanette Nunez and 3 separate industry working groups, which really included every sector of the economy. The first one was chaired by future Senate President Wilton Simpson. The second one by Dana Young, the President and CEO of Visit Florida, and the third one by our Education Commissioner, Richard Corcoran. The governor pulled together business leaders, local and state elected officials, education experts, and healthcare experts to make up this task force. But I'm pleased to share with you that in total, the Florida Chamber had 34 of our members participating, either at the executive committee level or the working groups. Our government affairs team and I covered every single meeting Monday through Friday, and on Saturday we shared a document with you that sort of encompassed our notes from those hours and hours of meetings and what we heard. In summing up those meetings, we heard three important themes over and over. The first one was that any reopening of the state, when it happens, needs to be phased in, and it needs to be based on hard metrics. The second theme was that small businesses will need special consideration. And the third theme was that businesses of all sizes and in all sectors will need clear guidance, and the guidance must be unambiguous and widely disseminated. In the end, customers must feel safe to go back out in order for reopening to work. May I have the next slide? This is a letter that we worked on over the weekend based on the input of all of our members we've heard from, as well as local chambers across the state. And we'll be delivering this to the governor's office today, but it actually encompasses many things we've been discussing with the governor and Shane Strum and Chris Spencer and the team for days. And you can see the recommendations there on the right. I'll just quickly touch on, we suggest that local and state and federal agencies coordinate so that employers have clear and concise and consistent guidelines. Number two, that liability protections be put in place to protect essential and non-essential businesses. Number three, that small businesses will need special considerations. Number four, that childcare and transportation for essential workers must be a priority. And number five, that we'll need certainty and consistency in the application of any and all rules and guidances put in place. Next slide, please. A copy of that letter will be available on our website, and we'll also send it out in tomorrow morning's message. Finally, if I had to rank the number one thing we've heard from our members all across the state as the greatest concern about reopening, is that businesses will be attacked by lawyers looking for new types of lawsuits related to COVID-19. And I have Senator Brandis's picture up because we've been in talks with him over the last several days, actually weeks now. And right after our last conversation with him about the importance of protecting businesses from lawsuits related to COVID-19, he sent out a tweet, which is on the right side of your screen. He's been working with us to prepare legislation, should we have a special session, that would seek to protect businesses from these types of lawsuits. We also heard this very point mentioned time and time again last week during the governor's reopen task force meetings. And Lieutenant Governor Jeanette Nunez and Speaker Oliva mentioned it in their closing remarks last Friday. May I have the next slide, please? It's now my honor to introduce the Governor's Chief of Staff and a great friend of the Florida Chamber, Shane Strum. Shane, we have been honored to work with you and the Governor and our team, your team, over the last several weeks. I have never seen an executive office work so hard in so many hours to do the right thing for Floridians as I've seen these last 4 or 5 weeks. And just want to thank you for the partnership and all you're doing in public service to our state. Shane, the floor is yours.
Man, what a very kind introduction, David. It's always a pleasure working with you. I've had an opportunity to work with you for many years now, and I can tell you coming back and being in this seat, knowing that the Florida Chamber has been there side by side with us has made an absolute difference. You also mentioned Chris Spencer, the governor's director of policy. He's done a phenomenal job, and I loved your remarks because, one, you summarized everything that we've been working on. But I'll take it a step back and also to thank your CEO, Mark Wilson. I mean, Mark and you were some of the first people we reached out to when we said, how do we reopen Florida? As you can imagine, we received a tremendous amount of calls and emails, and the real question nonstop was, how are we going to open? When are we going to open? What's the appropriate way to reopen? What are the guiding principles? What would be the roadmap? Are there mitigating circumstances? Will there be guidance on that or overall protocols? And I can tell you those conversations we then shared and talked with you about, and we huddled. And, you know, the governor's task force has done a remarkable job. In a short amount of time, they really accomplished a lot. I mean, I spoke to you guys, a little while ago, and you mentioned quite a lot of it, so I won't go over everything again. But I think what's important for your folks that are on the line, they're the backbone. They're running some of the largest companies across Florida, all the other chambers that are involved. They have been absolutely amazing in making sure we're communicating and getting out the message to all the businesses, because we're trying to have a unified voice, and we want everyone to understand what we're doing, that there is a methodical approach to everything. And I think that some of the great steps that we're taking were really the governor launching the task force. One that had over 110 experts, members that really brought a lot to the table. A lot of your members were on there. You had Sid Kitson. I could name a lot, but folks that really stepped up to the plate, that wear hats for other things, but such as Sid, who's also the BOG chair. So we had over 100 experts. We had over 14 meetings, and of those 14 meetings, the governor wanted us to work quick, expeditiously, and deliver a product quickly because he didn't want this to drag on. I believe they logged over 20 hours of conversation and dialogue. We really heard a constant theme. Are we going to provide materials for the small businesses, medium and large-sized businesses? I don't know if your members or others have seen it, but I would imagine they did. They also posted a site or a link for people to go on to. It's had over 40,000 public responses when I looked at it this morning, which is absolutely unbelievable. And I think hopefully some of the folks were able to see that Governor DeSantis today was in Washington. He was invited by the president to come to D.C. to kind of talk about what has Florida done. And I think the governor really delivered a strong message that, Florida's always been data-driven in its approach. And part of that approach was used to help flatten the curve. I think part of the message that the chamber and the business community has been out there is like sharing the plan for how are we going to be smart, how will we be smart, what will be the step-by-step approach to finally open the state's economy. And I think one of the things that he said on there was, Florida's ready. The numbers are moving in the right directions, and the state needs to reopen. One of the other criteria is gating. We meet the criteria for phase 1 to begin the reopening and launch. And with that, I think some of the things that are probably important for everyone to know and agree on is what is this approach going to look like? How do we have a thoughtful, methodical, phased approach? This is important. We've been in consultation with the chamber, and then the task force is you said it funny, you guys have been putting in a tremendous amount of hours. So everybody worked hard last week, and then this weekend, Chris Spencer and his team, the Office of Policy and Budget, wow, they worked all Friday, all Saturday, and all Sunday. They were here till midnight. And they're working on these recommendations. They presented some of the findings and all the words last night. When the governor returns from Washington, D.C., the team will be meeting him once again and kind of rolling out how this approach is going to look. We understand that some of the things that we're being tasked with and hearing from your group is what is the clear guidance, but not only just for business, but for individuals, businesses, and specifically small businesses or other businesses that had mitigation strategies deployed early on. We understand that the restaurants and bars and a lot of others, we try to phase the approach, and then eventually those are ending up closed. They're absolutely ready to get back out. We mentioned earlier, what are some of the things that you can help us do? Continue with the recommendations, but get ready for us to light the candle and have the governor make his announcement very soon. But what you all can do is help us communicating the message. Another area that the chamber worked on is not only did you work with all your chamber members, but you did a really great job working with local government. And the governor did the same thing. He was on the call on a daily basis with most of the mayors, most of the elected officials across the state, but also the businesses, the companies, small, medium, and large, to really get a feel for what's going on. And I think you saw a lot of that work extremely well in South Florida. South Florida was the epicenter, had the largest number of cases for test positive, a number of deaths, unfortunately. They will probably be a little slower as they're rolling out. They're going to have some announcements on Wednesday. It looks like their approach, from what we're being told and they've shared yesterday, or marinas, recreational, and a few other things that they're working on. So I think, as we look at this, another really important area was medical professionals. We heard a lot from people that they wanted to know, what did the medical community think? What were some of the things that they would be able to share with us that would be the appropriate way to reopen? So everyone agrees we need a phased approach, but were we in consultation with our medical professionals? And, were we using science? Were we using numbers? Were we using metrics? How do we continue to work, as a team to get this message out and work with everyone? So I think as we continue to move forward, you're going to hear more later today and tomorrow. I think the governor is working to have some type of announcement. But I know that the business community really has said this to us, I can say loud and clear. But Florida's reopening must be phased, and I'm kind of rehashing what you said, David, but must be phased, safe, smart, step-by-step, that so the customers feel safe to return and employees also feel safe to return to work. I think if we do that together, we're going to get through this and we'll come out of it even stronger. So I think that I want to thank the Chamber again. I want to thank Chris Spencer in the Office of Policy Budget. I want to thank the task force for putting in their countless hours and time. That was a rushed week, but I think they really provided a great work product. And we're going to be here with you as we begin the Reopening Florida launch. So thank you for your time, and thank you for allowing me to speak today.
Well, Shane, hey, it's Mark Wilson. Shane, thanks very much for that. I know that, we have a couple months now of, everybody wanting to know when can we go back and what are the guidelines going to be. And I appreciate you coming on today, both to our local chamber leaders this morning. We ended up with 185, and to this call this afternoon. I know everyone's anxious to get back, and I know the governor's in Washington today meeting with the president talking about the Florida plans. And we appreciate, I know you said that beginning tomorrow we're going to start to get some more specifics. And I wanted to acknowledge, you and I both talk about this all the time. We both wish we could hurry up and, advance a month or two or three down the road. But on behalf of our membership at the Florida Chamber, we know you all are working long hours, and I know that the more specific the guidelines can be, as soon as we can, the sooner local businesses can start helping you and the governor, get things back in a safe and orderly way. So we appreciate it, and we know, Shane, I know you and I will talk later today, and, maybe later in the week as things start to materialize, maybe we can give another update once we know the specific guidelines, throughout Florida.
No, absolutely, Mark. It'd be a pleasure to do that. And also, and you brought up a good point. We are going to do it measured and safe, but we're going to do measured but really rigorous guidelines that will be in consultation with medical professionals and health metrics. So please let everyone know that we're going to get as much as we can to you as quickly as possible. And you and I will also be speaking offline as we continue the conversation and dialogue for reopening Florida.
You bet. Well, please thank Diane and the whole team there, and Chris and everybody. We appreciate it, Shane. We'll be back in touch later.
Absolutely. Have a great day.
You bet. You too. So what I want to do now is I want to quickly move through what we're doing inside Florida and across the country. And I think that what's really important here is that we have a common set of guidelines and common communication between all of us. We simply cannot afford to be like Singapore or some of these other places where they reopened their economy. They didn't have the appropriate safeguards in place. They treated every industry and every hotspot the same, and then they ended up with a second spread that was worse than the first. And then what happened is in Singapore, for example, they closed down schools, businesses, and they shut down all travel. In fact, they closed down all gatherings for non-family members. They had to do that a second time. And so that's a bit about what we're trying to do here. What you see on screen here is a partnership that all 50 state chambers have formed with the U.S. Chamber. And what we're simply trying to do here, and I'm speaking to those of you now who operate in a local environment and you work closely with your mayor or you work closely with your county commissions, it's going to be very important that the White House has laid out guidelines, the gating criteria that Shane talked about. The governor is going to be very aligned with those criteria. He's made it very clear, right, that we may not open the whole state all at the same time, that each industry sector has its own set of safety guidelines. And so we're going to open this in a very methodical way. It's going to be based on health guidelines. But here's the concern that we have as state chambers across the country, and something that I'm asking every local chamber of commerce and every business in Florida to stay united on. We have 412 cities and 67 counties in Florida. And if we have 412 and then 67 counties, if we have different interpretations of what these guidelines mean, then we can have one type of guideline in one city and another type of guideline in another city, and those cities could be 2 miles apart. And we could be seeing a respread of COVID in certain areas of Florida because not everybody's following the same guidelines. And so if we want to get through this quickly and safely and not suffer what some other countries have, I'm asking everybody to help us make sure that this is executed right at the local level. And I will tell you, I know it's a presidential election year, and everybody wants to talk politics. There is no room for partisan politics in the reopening of Florida's economy. And I ask everybody to be on the same page with that. Next slide, please. So we had some good news that we shared in our morning email this morning for a number of corporate taxpayers in Florida. They extended your due date by a month. I spoke directly to DOR this morning about this, and the obvious goal here is for those of you who are doing quite well through COVID, go ahead and pay your taxes. For those of you who are really struggling, this was meant to give you an extra month, and that's sort of the Florida way right now, and it's certainly appreciated. So next slide. So a little bit about, we're not going to go into great detail on this today, but what I want to make sure we're all on the same page with is just as the White House is working with governors and governors are working with mayors and counties, so too are chambers of commerce. And so what you're looking at here is a slide I shared with you last week, which is what did Florida look like before COVID happened? That's what's on the top. But what I really want you to pay attention to are the sort of the uniqueness of Florida, right? We're about to enter hurricane season, which is a huge challenge when you think about sheltering. And think about 1 in 5 Floridians is a senior. So we have vulnerable populations that other states don't have. And then we also, if you look at the unique makeup, we don't have a personal income tax. So our tax structure in Florida is a bit more susceptible to fluctuations in, say, what's happening in tourism and hospitality and food services and restaurants. But also, if you look at almost 80% of our general taxes in Florida, general revenues anyway, come from sales taxes and use tax. And you have to know, the Florida fiscal calendar ends at the end of June. So, part of March, certainly all of April, all of May, part of June, we're clearly going to see some declining revenues. What does that mean? We'll probably use the entire $5+ billion that came from the federal government, and I'm hearing we may even need to tap pretty significantly into some of the reserves. And again, we just don't know. But keep in mind, that's what's going on in the background. The main point, though, of this slide, I really want to direct your attention to this issue of, will this recession be V-shaped or U-shaped? And I just want to tell you, I think a lot of this is up to the business community. No one wants to reopen faster than I do. Well, maybe the governor does, but we want to reopen as quickly as we can, but it has to be done right. That V shape you see on the top there is what happens if we all work together and we have common guidelines and we leave politics out and we're able to reopen without another spread of COVID. That means we'll recover probably in the first quarter of the year, possibly by the end of this year. And recover simply means back to where we were in March. If, on the other hand, we go the way of Singapore, then we're into a U-shaped environment, and there's really no telling what happens in that scenario. So I'm really counting on the business community to unite together, take this seriously, and work with the governor on the guidelines. Next up, you're going to see a lot of press in the coming days, and I think that the more we can do to talk about a balanced reopening, it's the right way to reopen. It's the fastest way to reopen in a way to stay open. So next slide, please. And again, we use words like restart and recovery. So we're about to restart the 17th largest economy in the world. That's what Florida would be if we were a country. And again, we're different than every other state. You can't just hit a light switch and say, everybody go back to work. There's certain parts of Florida that are more ready than other, and there's certain industries in Florida that are going to have different safeguards than others. And that's what everybody's working on behind the scenes. We've asked the governor to give all of you as much time as possible to know what the reopen looks like for your geography and for your sector, so that you have ample time to get ready for that. And we have every reason to believe that that's what the rollout will look like. Next slide, please. We've talked a lot today about connecting the national to the states to the locals, and that's exactly where we're going. Next slide, please. I shared this with you. This is the White House's and the CDC's gating criteria. I think we shared this with you 2 or 3 Fridays ago, within hours of when it became public. And if you were to look at one slide and understand what it means, this is probably one of the most important. And the reason is each area of Florida has to meet 5 of these 6 gating criteria, right? So these, when I rolled these out to you 2 or 3 weeks ago, the whole idea here was you're in charge of a lot of these numbers at the local level. And for example, I spoke with Fort Lauderdale earlier this morning. They believe that they meet every one of these except for the robust testing criteria, but it won't be long before they do. And so if you want to know what you can do locally to sort of hurry up the process of reopening your region, it's to get everybody, your mayor, your county, your business leaders, your employees, to get everybody in your community realizing that these are the rules that we need to follow and meet from a health standpoint in order to reopen. Next slide, please. Again, we're working with well over 100 local chambers, and I'm very proud of chambers and economic development groups because they've positioned themselves to really help do what they do best, which is convene the right leaders in their community. So if you're looking to get involved locally, just reach out to us at the Florida Chamber. We're all more connected right now than we ever have been, and we certainly appreciate it on this end. Next. The last thing I want to share before I turn it over to our chief economist is really what to expect in terms of sort of new rules. I've got this slide and then one more that I want to share. So I think what you're looking at on here is, if you look at the left side, right, we don't know when a vaccine is coming, but until that day, until the vaccine is here and we can handle this virus that way, these are some of the new rules of the road. And we don't know how long they're going to be around, but the more your company and your region can innovate and adapt here, the better off we're going to be in Florida at setting that global example. Next slide, please. And then finally, what I wanted to share with you is all of the research that we've done from across the country, and in looking at the guidelines from the White House, and in looking at the clarity that Governor DeSantis has given us. There's really 6 areas that every community of Florida needs to make sure you have covered. And we're not going to go through these in great detail, but the first one obviously is excellence in healthcare delivery and healthcare capacity. It's written all over the CDC and the White House guidelines, and Governor DeSantis has made this front and center. Also, this Safe Business Restart Committee, each region of Florida is different than the other region. So as I mentioned this morning, if you're in Miami and you have a port and you're international, you have a completely different set of challenges than, say, Palatka or Tuareg or Baghdad or Milton. And so the framework is the same, but how you operate it locally is obviously going to be customized to the types of businesses that you have in your area. The next committee is the Every Zip Code Matters Committee. And keep in mind, we have vulnerable populations. We know that. Seniors are more susceptible to this. But the Florida Chamber Foundation's Prosperity Initiative has been working on solving poverty for children for a long time. And we have over 871,000 kids in Florida that are in poverty, and that's before COVID. And so we know that those special zip codes, just like 32304 here in Tallahassee, those zip codes are more susceptible and they need our help. And so to focus the business community's resources in your community where the help is needed most is something we just can't forget about right now. The regulatory and policy committee that we're suggesting be set up at the local level, again, 412 cities and 67 counties, it's very important that the business community lead the conversation about what will the guidelines look like in your local community. And we need the business community to insist that we don't have a patchwork of 412 different sets of mandates and regulations at a time when we need one common sort of roadmap and speed limit, if you will, that we all can follow. Obviously, there's going to be retraining of workforces, and so we're recommending that you work with your colleges and work with your career source teams and others at the local level to essentially put together a game plan that's customized for you locally. And then perhaps it's a little bit too early to be thinking about it now, but be thinking about what the future economic development looks like in your community. Be thinking about how Florida can become the global capital of the best place to remote work after this, right? We all know about our quality of life. We know we have the best colleges and universities in the United States, and this is a great place to live, and we can leverage that moving forward. Think about global supply chains. There's a big push right now to move supply chains back into the United States. That takes 2 to 4 years to do it right, but many of you are going to work with us on the Florida Chamber Foundation's Trade and Logistics Report, where we're going to be talking about how can we move more manufacturing back in, not only to the United States, but specifically into Florida, and how can we take advantage of what Doug Wheeler runs, the Florida Ports Council. How can we take advantage of our 15 ports and all of our airports and our strategic geography as we start inshoring more manufacturing jobs? We can take advantage of our supply chain strengths here in Florida. So again, we're going to be working with Enterprise Florida and with our economic development friends at the state level, but I would encourage you locally to be thinking, what special attributes do you have in your community that can specifically be leveraged once we open back up again, and we can be thinking about, how can we further diversify Florida's economy? So with that said, I'd like to go ahead and fast forward to Dr. Parrish now. We are, and I know I've said this several weeks in a row, we're blessed to have Dr. Jerry Parrish as our chief economist. We're the only Chamber of Commerce in America with a full-time chief economist, and again, you're going to get a little flavor today of some of the reports and analysis that Jerry's put together. We shared some of this with local chambers this morning, but for those of you who weren't on that call, some of this you're seeing for the first time. Nobody's seen it before. So, Dr. Parrish, the floor is yours.
Thanks, Mark, and thanks everybody for being on the call today. I really want to talk about the numbers today. I really want to dive in pretty deep to some of the numbers more than we have. First of all, I want to show you what this morning's email looked like, the map that came out, and talk more about the numbers that are on this slide. This is the number of positive cases by county for the whole state of Florida. And if you've been getting our morning emails, you see one of these maps every single day with an update. If you're not getting these, you can sign up at floridachamber.com/coronavirus and get these emails. It's got the maps. It's got tons and tons of info on there about what's going on in the state and things that can help your business, and a lot of cool stories about what a bunch of great Florida Chamber members are doing around the state. A couple of things I want you to look at. First of all, this is a heat map, so the higher numbers are in the darker colors. Take a look at Southeast Florida, Miami-Dade, Broward, and Palm Beach. They have consistently accounted for about 59 to 60% of all the cases in Florida, and they've only got just less than 30% of the population of the state of Florida. So they're running at basically double the density of the state. So you've got all these other counties that are actually, spread out with 40% of the cases, and you can see where they are. A couple of other things I want you to notice. We show the increase in cases daily. I'll talk more about that later. But also the percent positive. This is the number of cases to date that have indicated positive for COVID-19. Now, I want to talk about some of the metrics. We've taken a look at at what the White House put out, they're talking about having a decline of cases over the last 14 days. I want to show you what they look like in Florida. Here's a map of what the number of new cases over the last 14 days. And interestingly enough, you can see that Southeast Florida accounts for about 60% of the new cases at all. But what you have to also think about is there's a few counties that have had 0 cases or just a very few. But remember, overall, since the very first day of this, there's still 8 counties in Florida out of our 67 that have 5 cases or less. 13 counties have 10 cases or less. 24 counties have less than 50 cases, and 35 counties have less than 100 cases. So we're still in a situation to where more than half of Florida's counties have less than 100 cases. Now, I think that's going to be important when we think about opening up the state. There's going to be metrics. We don't know what they are, but let's look at the next slide. Here's one that I think may be something that they use. This is the percent of tests by county that have indicated positive as of the 27th, as of yesterday. So excuse me, you can see where your county is on this. Once again, it's a heat map. The darker counties are the ones that have the highest percentage cases. And so think about where you are, the number of cases your county has, what the percent positive are. Are they higher or lower than the state average? That may be some of the criteria that we're looking at. Another thing I've been looking at is, wow, look at how sudden this thing has come on. I hope we haven't forgotten this. But remember, it's not been that long ago to where we didn't even know what COVID-19 was here in the States and certainly in Florida. So I did some calculations, and I took a look at how long these cases, how long has it been since a confirmed positive case has been in your county. And so you see the number in your county, that's the number of days. Notice Hillsborough is number 1 at 57 days. That's where the first 2 cases were confirmed on the same day on March the 2nd. So we really had, less than 2 months of even having this virus confirmed in the state of Florida, yet you've seen what it's done. I have a feeling that when we look at reopening Florida, this will have a little bit of an impact because what you want is it to be long enough to where the disease has had time to develop, expand, people get tested, and then start going down, because remember, the White House guidelines are going to call for a 14-day decrease. Now, what's all this done to the Florida economy? A couple things I want to show you. Here's the list. Here's what the number of initial unemployment claims have been in the state of Florida over the past 5 weeks. You see the earlier numbers in here from 2003 to 2019. That's from this time of year. How many cases on average in an average week would you get? You remember back in 2009, that's the top number at 24,592. When the big numbers started rolling in, 74,228, and all the way up to 505,000, which was week before last, because we get these on Thursday for the week before. Then you can see that, wow, this has had devastating effects on the economy. Mark's already mentioned the impact that it's going to have to our state tax base, tax collections. That's going to have an effect on your county as well. Now, one other piece of economic data did come out this morning. That's Florida's consumer sentiment. It's put out by the University of Florida's Bureau of Economic and Business Research. The number came out at 75.9. Most of the numbers over the last year have been between 90 and 100. Last month there was a record drop down, and then another big drop down this month to do 75.9. That's, you can tell consumers are reacting. However, we're not seeing the record lows we saw back in 2008. It actually got down to 58.8 in 2008. I think consumers in Florida are realizing that, hey, this is a temporary thing. Yes, it's bad right now. We can all, understand that. However, they do see other states starting to reopen. they're going to expect that at least parts of Florida are going to be reopening, and that in some cases a lot of the businesses will go back to a new normal or a more normal situation. Now, one of the metrics I think they may also use, I've had to study up on my epidemiology because I certainly am not very fluent in that. I came across a number, it's called an R number, and the R number indicates the number of people that each person infects when they have a disease. And I've seen some of the other diseases. There's things like measles that are super highly contagious, and their R numbers are in the teens. So every person that gets infected ends up infecting, more than 10 people. Where does the COVID virus sit in Florida? I want to show you now. I want to show you a number from about 4 weeks ago. And you can see the site of where this thing came from. Really interesting site where they show the number by state. And so 4 weeks ago, on average, every person in Florida was infecting 1.22 other people. That's a pretty high number because at the time, all 50 states had a number of 1 or above. Keep this in mind. If the number is exactly 1.0, every person on average infects 1 other person. So really, the virus never dies out until basically everybody's infected. So what you're looking for is a number, to hit 1 and then go down below 1, and that'll show that the virus is going to die. So 3 weeks ago, here was the number. We hit 1, and our actual first day of hitting 1.00 on the estimate was March 31st. There were still 41 states, including Florida, at this number or above. So that tells us that some of the other states were ahead of us. But where have we come in the last 3 weeks? Here are the rest of the numbers you can see. We bumped down to in the 80s and high 70s and back to the 0.8. And you can see that just barely 2 weeks ago, 21 states. A week ago, 11 states. Still 8 states, and these are in the Midwest, where the virus is actually behind where Florida is and other states like that. So what you can take from this, I believe, is certainly the virus is on the path to, getting less and less as far as the number of people being transmitted in there. I think that's a really good sign and a positive sign that Florida, at least parts of Florida, will open sooner rather than later. Now, one of the things I track every day is the number of new cases per day. And so every day you see that on the website. Here's the actual breakdown by day of the number of cases. And it's hard to make a pattern out of this because you see some days like April 17th, 1,400 plus cases, April 23rd, 1,300. But if you really look at this and track that, those were 2 days where there were a ton of cases that were reported. So yeah, there was a lot of positive cases, but what you can't see from this chart is the fact of from early April till now, our rate of positive tests has gone from about 11% to 9.0%. So actually, what's happening is, there's a lot more tests. We've actually done more than, or right at 300,000 tests just in the month of April alone. We only did about 60,000 tests in March. So we're way more than doubling the tests, almost a multiple of 5 times. But to think about the last 14 days, are we going up? Are we going down? So what I did was I overlaid on this a 14-day moving average. And what you can see from that moving average is it peaked on April the 12th. So if this is actually going to be a metric that they use, and they may, I'm not sure what's going to happen, our number has gone down from 1,094 on April the 13th to 794 now. So that number certainly qualifies that we've been going down for more than the past 2 weeks as far as statewide. Not every county is at that number. I will tell you some of them are starting to plateau now. It looks like they may be heading down. But overall in Florida, I believe some of these metrics that I've just shown you are going to indicate that while we are on a positive track, that will help us open sooner rather than later. And when we get the criteria of what actually is going to happen with the state, I hope you'll remember this and see that we've been tracking this. Certainly, anytime you have a question about your county, please feel free to give me a call, and I'll try to help you with get some data. Mark, that's what I wanted to show you this morning. I'll turn it back over to you.
All right. Well, thank you very much, Dr. Parrish. And I want to thank all of our members for being on the line today with us as well. And I want to thank Shane Strum in the governor's office. We'll be working with them this afternoon and tonight as we get ready for more announcements tomorrow. What I did want to share with everyone here is we have some questions that have come through. Many of you have used the Q&A feature at the bottom of the screen, and I'm going to go ahead and move into our Q&A portion. What's on screen now is you can see every day we have the daily email, and we're going to continue to send that out. One of the reasons that we're getting so many accolades for the daily email is many of you have made requests about what you would like to see in the daily email. So you know that we put both economic data as well as data on what's happening with COVID in there every single morning, 7 days a week. We'll be pivoting to sharing with you everything that we know relative to the guidelines that the governor will be laying out shortly. And then also every county and many cities are going to then have their own guidelines, hopefully, crossing fingers. They're all aligned, and we don't have a lot of conflict, but we'll be, again, trying to give you that information in concert with over 185 local chambers. But in terms of questions that have come in, I'm just going to take these in the order that they were sent to us. Please know if you send us a question anonymously, it's hard to answer back if you asked a specific question. So for those of you who are asking anonymously, there's not much I can do. But let me take a couple of these. I'm getting a lot of questions wondering if these slides are going to be available. We do plan to send out this presentation later today to everyone that was registered and participated today. So hopefully that's not just the slide deck, but also the narration that went with it. There was also a question about whether medical doctors have been involved in the task forces and in the recommendations. And I think it was 3 weeks or 4 weeks ago, we had Florida's top medical doctor, our Surgeon General, who runs the Department of Health, Scott Rifke's on the line. And I think I said then, and I stand by it now, I would trust Dr. Rifke's with my life. And he's been not only very involved in all the task force recommendations, but he's also been next to the governor in almost every recommendation that he's made. And then you heard the Chief of Staff, Shane Strum, today share just how much time the governor's been spending, especially lately, with medical professionals and hospital leaders and so forth. So I think May 8th is the day when Florida hospitals are able to start doing elective procedures again. And so a lot of hospitals in Florida are gearing up and getting ready to reopen that side of their business. So, all right, let's see what other questions. There's a question about sharing the local task force framework, those 6 committees. Absolutely. We'll get that out to you later today. One of the questions is, will there be guidelines for employees returning to work that have underlying health conditions? Again, if you look at the White House gating criteria, they're asking us to remote work as long as we possibly can. And also, as Jerry mentions, communities are going to have to meet the gating criteria as they move into each one of these phases. The Florida Chamber Safety Council and its advisory board is working on return to work standards and return to work policies. For those of you who participated in our OSHA conference the other day, we've been having online safety training for everyone who participates with the Florida Chamber Safety Council, and we were able to ask OSHA quite a number of questions about this. And to their credit, they were incredibly honest and said this is a developing situation and they didn't know some of the answers yet. They were going to go find them, and then we'll have them back again. So again, this country, none of us have ever gone through restarting the world's largest and most complex economy before. And so we're going to have lots of those types of questions. So bear with us. And again, the morning email is going to be the very best place for you to get that. Let's see. That may be That may be everything that we have. Just a second. There's a question here about how can Florida Chamber members access the 14-day moving average. Dr. Parrish, do you want to comment on that? I will tell you, as Jerry's thinking about that, I would expect in the next 48 hours you're going to see quite a number of public dashboards become available. I think that the governor's office has been very clear that we're going to use hard healthcare metrics to determine the reopening of regions in Florida. And I think that the only way that, all of us can be on the same page with that is to be able to answer this question. I will tell you, Dr. Parrish has been doing various 14-day moving averages for me for the last several weeks now, just to see all the different ways you can calculate it. And there's a lot of ways to calculate it. But Dr. Parrish, do you want to comment on what you're seeing anyway? I don't think we've seen sort of the official way that states and counties are going to use, but you want to take a stab at that?
Thanks, Mark. No, that's one of the things that I'm waiting on. Just to be clear, these are just ways that, things that I want you to look at that may or may not be used. And like Mark said, there's a lot of ways to calculate a moving average. There's leading moving averages, trailing moving averages, and unless you're a statistics geek, I could ramble on for a long time and you still wouldn't understand it. I don't know what they're going to use, and I'm not 100% sure. They may go with a shorter moving average, like a 7-day. Basically, any of these moving averages are just trying to take out, the highs and lows where you get that jump, where you had a bunch of tests reported, that 15,000 tests in a day reported, and you ended up with more than 1,000 new cases. But like Mark said, I believe we'll see an official way that they're going to use to calculate it here in the next few days.
Yeah, thank you, Jerry. And I think also another way to look at that also is one of the White House gating criteria is testing at the local level, but it's specifically testing for those in the healthcare field. And there's also language about the antibody tests. And so I think we're very much looking forward to some consistent guidelines that every county in Florida can use. So as those of you who are working with your hospitals and healthcare professionals know at the local level, having a common standard there or a common guideline is going to be hugely valuable for Florida, and I'm confident that that's what we'll have. So I believe, let's see, I have another question here. Let me just, it's a long one, so let me see if I can summarize it. In summary, it has to do with, Florida is already a hotbed for lawsuit abuse. In fact, we have the 46th worst legal climate in the United States. And I think, what we've been seeing at the Florida Chamber is the personal injury trial lawyer crowd that, advertises on TV and has all the billboards. They've been very active lately, making no bones about the fact that they expect to sue everybody and anybody that they can. And so there's a question in here about frivolous lawsuits and lawsuit protection. Very heartened to see. Keep in mind, Governor DeSantis stood with me at a press conference months ago and talked about the need for the Florida legislature to fix our broken lawsuit abuse climate. Now, that was before COVID hit Florida. And, if you want to look for some encouraging news, in addition to what the governor's been talking about, look at our Speaker of the House, Jose Oliva, and he served on the governor's task force, and he made some very clear comments that were in line with what David Hart talked about earlier with Senator Jeff Brandes, that as we restart this economy, we're going to need to take seriously some common sense legal protections. Again, every business that's a member of the Florida Chamber that I come in contact with on a regular basis, safety and health of your employees is job number one. And as, the government forced us all to shut down, as the government starts having us reopen again, it's not the time to hit everybody with gotcha lawsuits. We were on a national call with the Wall Street Journal earlier today, and this question came up. And if we have a guideline that says we should be 6 feet apart, but, 2 people are driving in a truck together and it's approved, let's say, by OSHA, and you followed every rule that you can, but somebody got sick, if the government approved it and asked you to do it, is it something that we should be opening ourselves up to for sort of gotcha frivolous lawsuits? From our perspective at the Florida Chamber, if an employer is using their best faith to keep people safe and keep people having jobs at the same time, now's not the time to open everybody up to frivolous lawsuits. So I appreciate that question. It's incredibly complex. I wish the legislature would have fixed our underlying broken legal system years ago, because we wouldn't be so susceptible to this. But, I don't know, maybe in hurricane season, all these billboards with trial lawyers will blow over, and maybe that'll lessen the blow a little bit. We'll see. Let's see. We have a question in here about when colleges and universities can open again. That's a complex question there, my friend. What I can tell you is, colleges and universities are open now. They've moved to an online world. We've been looking. Purdue University in Indiana announced they were going to open for regular classes this fall. Boston College announced that they were not opening until January. What I can tell you is when you look around the globe at some of the other nations that are 4 to 8 weeks ahead of us, and again, I'm not suggesting Florida will follow this or not, but when you look at the countries that are 4 to 8 weeks ahead, schools are usually the last part of the economy to open back up, and colleges and universities are typically the last part of the education sector to open back up. Again, I'm not suggesting that's how it will happen here, but that is, in fact, how it's happening in other countries. And so I don't know whether we'll have common standards in the United States on that or not, but I will tell you this. The chair of the Board of Governors, Sid Kitson, is a former chair of the Florida Chamber and a former boss of mine. And the current chancellor for the university system, Marshall Kreiser, is a former president of AT&T, and he's a former chair of the Florida Chamber. So they will have our complete and full support, as does Governor DeSantis. And I have no doubt that the safety of our faculty and the safety of our students will be paramount, as it should be. Let's see. Jerry, there's a question coming in here about economic stimulus for the tourism industry in Florida, and I'll give that one to you. I think, just to put in perspective, we have, close to 130 million visitors to Florida every year. I think it's 127 million that we know of over the last count for the last year. And keep in mind, Florida doesn't count visitors from one part of Florida to another. So these are people from other states and other countries. And we have around 14 million of those visitors come from other countries. And some of them come from well-known hotspots. And so, again, I've been talking now for a month that Florida is very unique. We're unlike any other state. And as we reopen, we're really going to need to think about how do we champion our tourism sector and our hospitality sector at the same time that we help them keep their employees and guests and visitors to Florida safe. But in terms of stimulus, Dr. Parrish, any ideas there?
I've been watching some of the committees, and Dana Young, our CEO of Visit Florida, has been running them. I've actually heard her talk about, get this same question, and I think what her answer was they're really concentrated on, they pulled all their marketing for now. They're going to concentrate on, on the other side of this, and they're working on the marketing campaigns for that. Certainly, we want those people to come back to Florida and enjoy their visits down here and bring their money. It's about $6 billion worth of state tax receipts and about a little over $5 billion of local tax receipts that people from other states and other countries bring in here. So I know they're working on it, but I haven't seen anything specific yet.
Okay, thanks, Dr. Parrish. I've had a couple other questions come in, and I'm gonna try to quickly answer. And again, I think everybody knows the way we operate at the Florida Chamber is we're going to try to answer as many of your questions as you can. And for those of you who don't want to stick around for these questions, we certainly understand it. We'll get this webinar back out to everybody later today. So one question has to do with quickly getting people back to work and the nexus to infrastructure projects. And I have some really great news here. Governor DeSantis is already ahead of everybody on this and has already ordered the acceleration of certain projects. So maybe we can talk about that on our next call. In fact, maybe in our email tomorrow, we can go ahead and provide you a list of many of the infrastructure projects that have already been accelerated. Also, I mentioned that, you know, Congress has now done 3.5 rounds of federal stimulus. It's over $5 trillion that has already been invested in relief and recovery efforts. I'm very, very bullish on the prospect of Congress doing a fourth or fifth round that would include a national infrastructure stimulus package. This country's needed that for a long time, and I think an infrastructure package has sort of been in queue, if you will, for a long time, and it's certainly appropriate now as we look to jumpstart the American economy. Another question came in here, and the question is, can you speak to any strategies to support nonprofit organizations? And I want to give you two right now. You know, the Florida Chamber is a nonprofit ourselves, and so we're very aware that we're an organization trying to help other organizations, and we've been negatively impacted just like many of you have. Unfortunately, when Congress passed the PPP assistance, they removed 501c6s from eligibility for these loans and grants. So trade associations like home builder groups and realtor groups and CPA groups and the bankers associations and chambers of commerce, even though we're working 7 days a week right now to support your businesses, 501c6s were not included. There's a major national bipartisan push to include C6s in future loans that Congress might make available. And so I believe that will happen in the next round or the round after that. But also, be on the lookout as we unveil the next version of our local framework for getting through COVID. You know, keep in mind that our Florida Chamber Prosperity Project has identified 10 root causes of poverty. And what we will be doing through the support of the local framework is we will be helping connect local nonprofits that are meeting the 10 root causes in an area, whether that's the healthcare needs of those in poverty or the food needs of those in poverty. I'm sure you've all seen the great work that Publix has done lately on that front. I'm sure you've seen the great work Florida Blue has done on the healthcare side. But whether it's food, whether it's healthcare, whether it's job training, Michael Williams, who's the executive director of the Florida Chamber Foundation's Prosperity Project, will be doing quite a bit of communications in the coming days about how the Florida Chamber can help connect companies who want to help with the local nonprofits who are really leading ground level, zip code level assistance. And so those are two ways that we're going to be able to help as well. There's a question in here about 501c4s. So let me open up that can of worms. In case everybody hasn't heard of this before, 501cs, there's 18 or 19 different 501cs. C3s and C19s were included in the first round of PPP funding. What would make sense is to include all of the other Cs so that we have agriculture included in this, farm bureaus included in this, and so forth. What we had in round one was charitable organizations like churches and veterans organizations. Those are C3s and C19s. C6s are what most chambers of commerce are and most trade associations, but what I believe Congress is going to do for nonprofits is to actually include all of the 501cs. That would be the right thing to do. So I hope that answers your question, Joe. Let's see if we have any others in here that haven't been asked anyways. Give me 1 second. I think we've covered them all. There's a question in here about remote work. And remember, about 25% of you said that you could work remotely indefinitely. And feedback that I've been getting from a lot of Florida Chamber members is that for some of your employees, for some of your divisions, you're actually more productive. You're better able to determine the efficacy and effectiveness of individual employees and their teams in a remote work environment. So we talked on last week's call about innovation and what might be around for years. I think remote work might be around for a lot longer than when COVID-19 passes us by. So let me just do one final check here and see if we have any more open questions. We had 23 questions come in. I answered some of them just responding directly, but I think that's everything for now. Okay. Well, I appreciate it, everybody, and I want to thank the Florida Chamber team for producing our webinar series. It takes hours of behind-the-scenes work to pull off every webinar that we do because there's so many moving parts. And again, I want to thank the Governor's Chief of Staff, Shane Strum. Thank David Hart for his part in this today, and Jerry, as always, thank you for your insights in what's happening from your perspective. So to all of our Florida Chamber board members, our members, and our Florida Chamber Foundation trustees, thanks for your support. We're all in this together, and expect another one or two of these in the coming days. We'll be calling the governor later today, and as we get downloads from the D.C. trip and we know what we can start announcing when, by all means we will. God bless, take care, and be safe.